All right, what up? This is Joan from MediU. My guest is a U.S. Army veteran who is currently active in the Tennessee Army National Guard. Her professional experiences range from military dentistry, corporate community health, and private practice, a health and wellness advocate and experienced cosmetic general dentist, owner and founder of Definition Dental Studio. We have Dr. Tiffanie Garrison-Jeter. How you doing, Tiffanie?
Hey, how's it going?
All is well. Thank you for joining me. I really appreciate you being here.
Thanks for having me.
All right. Well, let's go ahead and kick it off. And just to kind of get you to know you a little bit better, I'd like to kind of get the origin of Dr. Garrison-Jeter. So tell me a little bit about your parents, who are your parents, where they grow up, stuff like that.
My parents are Christine and Jeffrey Tyus. They're from West Tennessee, a little country town called Ripley. That's where we're from. When my mother graduated college, we moved to Nashville. So I've been here in Nashville since I was 6 years old. So I'm a Nashville native, one of the few. I'm a unicorn. Just regular, down to earth country people. That's who we are. Nothing spectacular, just good people.
Okay, cool. So yeah, I'm familiar with Ripley in West Tennessee, so I like that particular area. So I was going to ask you where you was born. So you say you're a Nashville native, moved here, I guess, when you were about 6 years old.
Mm-hmm.
That's cool. So do you have any siblings or anything like that? Where do you fall in your family?
I'm the oldest.
Oh, okay.
I've got a sister who is 15 years. My youngest sister is 15 years younger than me. And then I have a brother who is the same age as me. Go figure. You know how that goes.
Yeah, that happens.
Yeah, he's 6 months younger than me. So we're the same age pretty much,
Yeah.
but I'm the oldest. So I've got a brother and I've got a sister.
Okay, no, that's cool. So seems like you're the kind of the head or the first one out. So tell me about your childhood. Tell me about a memorable experience that you may have had that you can remember from your childhood.
So I was always the person that's like singing and dancing at random times. I love music. I love to sing, love to dance. So most of my memories just come from just running around singing and dancing in the church choir and stuff like that. When I was in high school, we had these like special little superlatives. So my superlative was most likely to sing and dance at random times. So music and singing and dancing, that's Tiffanie. That's me.
Okay, no,
Yeah.
that's cool. So what do you think kind of gives you that little energy to kind of sing and dance?
I mean, I'm talented, you
Oh,
know.
okay.
I got many talents. I have a beautiful voice. Just recently, I had my thyroid removed, so I'm still in the process of healing from that. So my voice isn't as it used to be, but I can sing. I got moves, and it just gives you energy just to stay in shape. So even like with working out, I like to do exercises that requires dancing and music and things like that. So it's just part of me.
Yeah, definitely. Just kind of built instilled in you. I like it.
Yeah.
So tell me a little bit about your high school experience. What drove you to kind of continue to further your education and maybe into dentistry or whatever else maybe at the time that you may have aspired to be?
So I always knew I wanted to be in the medical field in some kind of way. When I was younger, I used to always watch emergency medicine shows, the blood, the guts, and things like that. My childhood dentist is Dr. Sloan. She's in Laverne. I saw that she was a mother, a wife, a business owner, and she still had that good flexibility and quality of life. So I was like, let me look into dentistry. So it was either to be a dentist or OBGYN, and I like my sleep. And babies come at any time of the day or night. So I chose to go the dentistry route.
Yeah, no, definitely. All right. So would you say she's like one of your biggest influencers or mentors so far?
Yes, even to this day, even when I opened up my own practice, even when I was in dental school, she, stayed with me throughout that whole time. She, sent cards and sent gifts when I graduated. When I opened up my own practice, she sent, a card and flowers and things like that. So she's been there the whole time.
Yeah, no, it's definitely somebody can have an advocate for you throughout the whole way. That's a blessing for sure. So I guess going towards you're going to school now and you enrolled in, was it TSU?
I went to Tennessee State University first for undergrad. I had a major in biology and a minor in chemistry.
Okay, so at that particular time, you've already known you're going to go to dental school. I'm in Tennessee. I'm going to do this.
I did.
At Tennessee State, and then I'm going to go to dental school. So dental school, I know we have some options here, but you actually went to Louisville. What kind of attracted you to go to Louisville School of Dentistry?
I did a summer program when I was in undergrad at University of Louisville, and so I was like, "Oh, okay, this is a nice, university." So I made some connections there. Secondly, I'm from Nashville, so there's so many different distractions and things like that,
Sure.
to kind of keep you deterred. And I didn't want any distractions. I knew, dental school was going to be tough, so I went that route.
Definitely. No. Well, speaking about dental school being tough, I guess what were some of the obstacles or barriers that you may have
Woo,
had to face
man.
that are like some big call outs that you could maybe share about your experience and maybe give a best practice for somebody along that way, just from one of your experiences?
So dentistry, it's science, but there's also a lot of art to dentistry. So you don't really know. I didn't really know how much it was required with my hands,
Okay.
So the science part, the learning the material, the brain part, I had that down packed. But I had to learn how to use my hands, make my hands do what my eyes would see. So it's a lot of art to dentistry. You had to learn literally. Our first year in dental school, we had like a little peg of wax, and you had to melt wax and build it up to make it look like a tooth that's in your mouth, like shaving, carving, all that kind of stuff. That didn't come naturally for me. So I had to, learn how to do that. The brain stuff, the learning the science and all that kind of stuff, that came natural for me. But that hand-eye coordination and being an artist, I mean, it definitely was something I had to learn. We normally break down dentists like den and then the dent and then the is, because artist is.
Oh,
So
okay. Okay. Yeah.
dental is an art. You are an artist because you have to make things look in the mouth like it's really supposed to be there, and you do that with your hands and looking through mirrors and microscopes and having to look but move your hands to what your eyes see. So it was definitely a learning curve for me there.
Yeah, no, for sure. So I guess what kind of helped you out throughout that process was like a special technique that you learned
Man,
that
hours in the lab, spending
okay,
hours and hours,
consistency.
hours, and I mean hours in the lab. Like I would, study for my test, and everything was good like that. But the dental lab was open 24 hours, so I would go home. Actually, I wouldn't go home. I would bring snacks so that I would be in school all day. And then after school was over, I maybe had a snack, took a little breather, and then I would go to the lab and I'd pull out that wax and I'd be waxing teeth and looking at pictures of teeth and doing all that kind of stuff until everything looked right. Just spending the time, putting in the time, putting in the work. That's why, I was saying, going to Louisville, I didn't have any distractions. It was just me in dental school. It wasn't, I didn't have family to worry about or friends nearby. It was just me in dental school.
Yeah, for sure. I can see how that could be the ideal process for someone. And then just kind of like you mentioned, I had a previous interview with Sean Giovanni, and he kind of mentioned when he was in school as well, just the availability of the lab. And you said it was open 24 hours a day, going in there and just utilizing that time as well. Now that's great to hear. It's kind of like a reoccurring thing that.
Yes, you got to put in the
Yeah,
time.
yeah, for sure. No, I like to hear that. All right, that's cool. So you've had your time in dentistry school, and then I guess after dentistry school, you decide, hey, let me just join the military, or that's not how that happened. Kind of give me the insight on this
That's not
military
how that
experience that you have.
happened. So dental school costs a lot of money,
Okay.
and I am debt averse. Like I do not want to have a whole bunch of debt because you got to pay these things back. A lot of people, they go to school and they take out these loans and they think they never have to pay them back. No, you have to pay it back. So when I got to my freshman year in dental school, different people, they come and they say, like, from the Navy, Army, Air Force, they come and offer you scholarships. So I decided I was going to do Air Force, but then I went to the Army because the Army was giving a sign-on bonus. I need to pay off my car. So so what they do is called a health profession scholarship program, where if you get accepted into medical school, dental school, veterinarian school, pharmacy, things like that, they offer a health profession scholarship where they pay for your school, they give you a living stipend, and they pay for your books. And so I was like, oh, sign me up. So I signed up. I got accepted into the program. And so after I finished dental school, I came into the Army as an Army captain, and I served as an Army dentist to pay back the time they pay for school.
Okay, yeah, no, that's nice. So I would definitely like to kind of explore that a little bit more. So with this particular program, you kind of got involved with it before school, or like
you have to have an acceptance letter to a dental school or a medical school or farm. You have to be accepted first.
And then you apply for the particular program. Okay, all right, that's cool. So once you graduate, you already came out as an officer, I'm assuming, a captain, correct?
I came in as a captain.
All right.
While you're in school, you're a lieutenant, and then when you graduate and you pass your boards and get your licensure, then you become a captain.
So, like, I have family members. My mother was in the military, my brother was in the military, but myself, I'm not too versed on military stuff. So, kind of, I guess, explain what that would mean, just having that particular status, just coming out of school or that particular level.
So when I first graduated dental school, I had to go through basic officer leadership course. So I had to learn how to be a soldier, pretty much. Because normally when people enlist into the Army, they go through like boot camp, basic training, things like that. So it's kind of like that, except for officers. So I had to learn like military customs and courtesies, who to salute and how to about face and do all that kind of stuff. We spent some time in the field. I did land navigation and sleeping in tents and different things like the military side of things. So I had to go through 6-week training to pretty much learn how to be a soldier, learn how to wear the uniform. So that's what I did first when I first graduated from dental school. And then after that, I went to my first military duty station, which is where they call, wherever you're stationed at, it's called your military duty station. So I was stationed in Georgia, so I had to move to Georgia. And I literally worked in a dental clinic on soldiers. So I would put my military uniform on. I'd come to the clinic, change into scrubs, treat soldiers, put my uniform back on, go home. So that's what I was a dentist, saving America one tooth at a time.
Yeah, for sure.
You'd be surprised. A lot of people join the military because they don't, have access to medical coverage and dental coverage. So a lot of soldiers that we saw, it was like their first time, ever receiving dental care. So it was like a lot of young guys, 18, 19 with severe dental need that, we had to address. Some people like 18 and 19, we were taking out all of their teeth because they never had any dental care, and it was just that severe. So I got a lot of experience with different areas of dentistry, and we had state-of-the-art equipment, being in the military. So I learned a lot being in there.
Yeah, no, definitely. That's interesting because I was going to ask you, I guess, being in the military, what were some of the more common dental problems that you may have seen? So I know you just kind of mentioned those with may have not had any coverage coming early in, and definitely taking advantage of that, because it's definitely a good benefit to have for sure. What were like some of the other common things that you would notice that maybe you've been in a private practice, but in the military, I guess you notice that maybe they have tend to see more of these issues here, I guess?
Well, since it is the military and I am an officer, a lot of the soldiers that I saw, I outranked them. Okay. So when they would sit in your chair and they would just be so rigid, because in their mind it's like, Captain Garrison-Jeter, this is Captain Garrison-Jeter, I'm in the chair, so I got to, be very rigid. And so that's one thing that was different. Like, they wouldn't, sometimes if they were experiencing pain or discomfort, they were less likely to say, hey, ma'am, something's bothering me, because they're soldiers and they're just, used to being that way. So I had to be more cognitive of reading my patient's eyes or reading my patient's hands. Like, some people, like if something was hurting them, they would, clench their fist a little bit. And then I'm like, hey, what's going on? So I had to be more aware of my patient while I'm treating them, because they may not have conveyed to me that something is hurting them or something is bothering them, because they feel like they probably couldn't say it because I'm Captain Garrison-Jeter, things like that. So that was one thing. I treated a lot of basic trainees where I was, but the particular clinic that I was in, we treated a lot of basic trainees, meaning they were just fresh into the Army. So I did lots of extractions, lots of, fillings and things like that to kind of clean them up and get them soldier ready. So our whole goal of having dentistry in the military is making sure that the soldiers are able to deploy. Because if you deploy and you've got a dental issue, nothing is worse than tooth pain. Okay, so if a soldier has tooth pain, they can't be out on the front lines. They can't do their job because that tooth pain will take you out. So our job was to make sure that our soldiers were medically and dentally ready to deploy.
Okay, yeah, I was gonna ask you what. So make sure, as long as they don't have any tooth pain, they're
Yes.
good to go.
Or
Yes.
anything that could bother them within 12 months, because people are gone 12 to 18 months.
Oh,
So
yeah.
we try to take care of anything that we think could bother them in the next 12 months. We try to get it taken care of.
Okay,
For
yeah,
'em.
no, that's definitely good to know. So I guess during your duration, throughout your time in the military, what were some of your memorable experiences that you had? Maybe not as just a dentist, or just in particular that you could kind of share.
I was in shape. I was
Okay.
fine. I was fine when I was in the military. Because, yes, I was a dentist, but I was also a soldier,
Yeah.
You two jobs, soldier and dentist. So we had, PT in the morning. And, it was to the point where I was working out like probably 2 times a day, because during my lunch break, I changed into my PT uniform. I'd go to the gym, or I'd go to the track and I'd work out. So I was in shape for sure. That was one cool thing. And also just the camaraderie, like the family. Like it really is like your unit is like a close knit type of family. So that was pretty awesome to see, and to be able to have like it was multiple dentists in the clinic. So to be able to like feed off people and ask questions, because that was my first job, being a true dentist outside of dental school. So it was cool to have, older dentists, mentoring dentists I could, piggyback off of, or show them this case or show them that. So it was cool to have that, somebody to, learn from. And
Yeah, definitely. So being that you said that was kind of your very first experience, would you recommend like that as like a first experience for somebody like, through your program that you went through the military school, and to come out doing like military dentistry at first, rather than maybe a private practice dentistry? Which one would be like the, I guess, the harder of the two? Or maybe, I don't know, it's probably opinion.
It just depends on the person. It definitely was it definitely was great for me, because I didn't have to worry about. So a lot of my classmates were worried about where am I going to get a job at, or am I going to open up a private practice. I didn't have to worry about that. I already knew what my job was going to be. It was already set. I'm going into the military. So it took some of that worry off of me. It allowed me to, because when you first get out of school, you're slow as heck. So if you go out into the real world of dentistry, it's going to be harder to make money because you're slow.
Yeah.
So being in the military allowed me to increase my speed and increase my skill set, so that when I came out into private practice dentistry, I was ready, because I had the time in, to learn on somebody else's time pretty much, and to get faster on somebody else's time. So it was a great learning experience for me.
Yeah, no, I can see that. Dig that. That's definitely makes sense for me. So I guess moving out of the military, I know you're currently in the Tennessee National Guard as well. I guess tell me about that. I guess does that just come naturally after, or you just
you can choose that.
Okay.
I chose that. I mean, I did 5 years in active duty,
Okay.
so I just didn't want that 5 years to go to waste. I mean, where else can you retire in 20 years? So when I get ready to retire from the military, I'll be 46, so I'll be able to have that source of retirement that most people can't say that they'll have. So it to me, it just made sense to just continue my service time.
Okay, yeah, interesting, definitely. We'll talk about that a little bit later as well.
Okay,
'Cause
cool.
I know you have some things that you do that are kind of beneficial to the service as well. So I guess moving on outside the military, here in the last few years, you've just recently decided to open up your own dental practice, correct? Definition Dental Studio. I see you have the shirt on.
We changed now it's Definition Dental and Wellness Spa, because we've incorporated a lot more services. But yes, Definition Dental Studio was the name. Yep.
Okay, yeah, definitely. So tell me about that. What inspired that idea? And I'm definitely interested in the wellness spa aspect. I kind of looked and browsed around and seen so many different things. It's got me interested. So kind of what inspired the idea? Because what you have at your particular studio, it's not something common that I see. That I've seen or even experienced just from my own places that I visit myself. So tell me a little bit about what is kind of inspired. You just want to get your own practice, and then I guess we'll start there.
Well, it was always my goal to have my own practice. Remember, I was telling you from the beginning, that's what drew me to dentistry, was that my mentor, she had her own practice, she had her family. So I always knew that I'm bossy by nature anyway. So it's hard for me for someone else to kind of tell me how to do things when I know I want to do things the way I want to do it. So you can't do that when you're working in somebody else's practice or when you're in the military or, if you're in community health dentistry, you can't do that. So that was one thing. And secondly, my practice has allowed me to merge two things that I'm very, very, very passionate about. First of all, is dental health and also wellness and just being confident. Like I love just, there's been patients that I've seen, like I've had patients who have been addicted to meth and then they're, recovering. And so the effects that meth had on their teeth and then we fix their teeth and then their life just changes. Like I love that. I love giving somebody their confidence back. So that's why I merged health and wellness into my practice. I love things that makes people feel confident and feel pretty. My nickname is Dr. Mrs. Pretty. So that's how we incorporated the Botox and the fillers and the veneers and different things like and body contouring to make people feel confident about themselves. I love that. I'm not just a dentist. I'm Tiffanie. I'm mom. I'm wife. I'm sister. I'm friend. I'm more than just a dentist. And I wanted my practice to incorporate all of that. And then also there's a stereotype of everybody's afraid of the dentist. Everybody hates the dentist. The first thing somebody says when they get in the dental chair is, "Oh, I hate the dentist." So I wanted my practice to bring an atmosphere, something that's different, to make people comfortable. You're still gonna get stuck with the needle, but at least you're gonna be in a comfortable atmosphere, when you do that. So that's my goal, to make people feel comfortable and confident and happy.
Yeah, I like it. I definitely like to kind of dig deeper into those specific services because you offer a variety of different things. But I know you noticed that you mentioned one thing a moment ago, talking about confidence. And I was going to ask you, how does the dental health affect confidence? And I have like some old stats, just kind of saying like, just depending on like the income levels, like say, let me see. Well, 40% of low and middle income level Tennesseans say life is less satisfying due to the condition of their mouth and teeth. And in Tennessee, 45% of that population reports that they have avoided smiling at some point during the last year due to that condition. And you just kind of mentioned earlier in regards to being a military deployable for at least they had to be at least ready for at least a year in regards to that. So can you kind of talk about, I guess, maybe from what you've noticed, like you just kind of mentioned like the recovering addict that you kind of help recover their smile, like. What do you notice? Like, how does that affect, like, just people's confidence in general? Like, what do you see? And, like, I guess, tell me a little bit more about it. Kind of explain to me, I guess, because I'm ignorant.
So, if you go in for a job interview, if you're going in for a job interview and you open your mouth and on paper, you may look great. You open your mouth and if you're missing several teeth or if you've got, decayed teeth in the front or smelling breath, you are less likely to get that job. They want to hire somebody who, represents their company well, who represents their brand well. So a smile is that. You want to date somebody. First thing people look at when you're going to date somebody, they open their mouth and it's not right. You're like, oh no, they was cute with their mouth closed. They open their mouth. It's like, no. So, it's just different things like that. Also, dentistry is, a lot of people looks at dentistry as like a commodity type of thing because everybody can't afford dentistry or the type of smile that they want to have. So I've worked in all aspects, military, community health, private practice. So I got a lot of fulfillment from community health because you were able to help people who may not have had the ability to go to a private practice and pay to get certain type of things done. So community health helps people who, don't have those, type of needs to get things done. So it's about confidence because if you don't have the confidence, you can't secure the job, you can't get the girl, you can't get the guy, your self-esteem is lowered. You're hiding your smile, you're a little bit standoffish if your smile is, if you're not confident in your smile. So.
Yeah, definitely. And that was one of the kind of the facts that I found as well. That studies show that most employers make instant judgments based upon appearances, including one's smile and teeth. Looking at different articles and stuff like that. This was from the Department of Tennessee Health, Tennessee Department of Health, looking at like their oral plan, and they're kind of seeing some things stating by the age of 34, more than 80% of people had at least one cavity. More than 40% of adults have felt pain in their mouth in the last year. On average, the nation spends more than $113 billion on costs related to dental care and $6 billion dollars of productivity is lost each year because people miss work to get dental care. I guess so. Some people, I guess, what I'm kind of at a loss here, just kind of seeing, because I know what, I guess, depending on the income level, people go to the dentist more or not. And then you were kind of speaking on community health. Like, what kind of ways do you all kind of promote, or do you see that's been promoted, I guess, into the lower income levels? Because I just remember, well, from what I've seen, a lot of lower income levels have like the issues with the dental and stuff like that.
I think it's twofold. Some of it is fear, and some of it is finance. And some people, it's fear and finance. Okay, so if you're fearful of going to the dentist, you don't go, and then you don't get the preventative care. Like a lot of people say, oh, I'm only going to go if something hurts. Well, that if you go when something hurts, that gets more costly. Then you get there, you don't have the money to do that, and then the tooth gets worse, more pain, more anxiety. It's just a snowball type of effect. So I think if we change the mindset of dentistry to where we're trying to be preventative in nature, I think it'll, help everything from a whole, because it's easier to treat something preventively than it is, once things gets bad. So a lot of, Medicaid and things like that, or dental insurance in general, they cover preventative care because it's cheaper to be preventive than it is to be reactive. That's my thoughts on.
Yeah,
on
no,
that.
for sure.
Yeah.
No, my question was a little bit confusing anyways
Yeah.
to begin with. But kind of since you mentioned that in the preventive care, are you seeing more of a trend of like just people just getting stuff fixed, not even doing the preventive care anymore, just kind of getting like the cosmetic stuff done just to kind of offset it? Could you kind of tell me a little bit about what you've seen?
Oh, me, that's a whole different little thing. But a lot of people think, I just want to, I want a pretty smile. I saw the baby get his teeth done, or, such and such get their teeth done. But they don't recognize that, yes, you can get your teeth done, but if your foundation is not solid, you're going to have, bleeding and periodontal health, loose teeth and cavities and things like that. So you have to get the foundation done first. I'm all about the cosmetic dentistry. I love doing I love doing veneers. I love teeth whitening. I love all that kind of stuff. But I'm not going to be a proponent of that if you don't have the preventative things. So if you're not getting your teeth clean on a regular basis, if you don't have good oral hygiene at home, it doesn't matter how much money you throw at me. I'm not going to do it. I'll send you up the street. Somebody will do it. I won't do it.
Yeah, no, for sure.
Yeah. I won't do it.
Not
Not with my name on it.
Yeah,
Walk
no,
around
it
pretty
makes
white
sense.
teeth, but your gums are bleeding. Like, that's not good. It's not just about your teeth, because the same bacteria in your mouth that causes the inflammation of your gums, it's the same thing that, clogs arteries and things like that. People say, they think that their mouth is just their mouth. No, your mouth is connected to your whole body. And that bacteria, those things that are in your mouth gets in your bloodstream, goes to your heart and different things like that. So it's a whole health type of thing. So I'm into cosmetics, and cosmetics is great, but you got to make sure your foundation is good and preventative care is taken care of.
Yeah, definitely. Well, I got a couple of random questions. I guess, how does substance abuse play a part in like the Tennessee dentistry organization? Because I know opioid use in Tennessee has definitely been on the rampant and quite still growing, and it is still going on for sure. So how has that played a part? Because now when you go get your teeth done, they don't give you lower tabs no more. They just kind of give you ibuprofen and stuff.
Yes, they've really cracked down on that. Mm-hmm. So honestly, with most of the time with tooth pain and tooth extraction, unless it was a very aggressive or rough extraction, you really don't need opiates anyway.
Okay.
And so I feel like it's a good thing that they're cracking down on things, because it starts with, oh, I had a surgery and, they prescribed me opiates, and they think, okay, well, my doctor prescribed these to me, so this must be safe. This must be okay. And it's not safe. Things will say, take every 6 hours. Well, just because it says take it every 6 hours doesn't mean you need to take it every 6 hours. If you're not having any discomfort, you don't have any pain. So, what I like to do is, if I really don't prescribe opiates too much, unless the surgery is really, really bad. But, it's educating the patient, let them know most of the pain that comes from dental things is inflammatory in nature. So we need to prescribe you an anti-inflammatory, aka ibuprofen. You don't need an opioid, for that type of discomfort that you're having. So it's just about educating your patients and educating providers. We know better now, so we can do better now. We don't want to be contributing to, opioid misuse and things like that. So it's about education.
Definitely. So, well, I guess in the beginning of the opioid use, what do you think was the original? I guess we're going to use opioids for dentistry. What do you think, or what do you know of what caused that, or what started it?
Well, I think pressure from patients. So,
Okay.
there'll be patients. I know I've had several patients who are calling, well, doc, I'm in pain. I'm in pain. Give me more pain pills. Give me more, the pressure of patients putting on the doctor, or they'll, say, well, I'm going to give you a bad review because I'm in pain and you didn't give me anything to take care of my pain. Well, it comes from educating your patients and being strong and being the doctor and trained person that you are, to give them some other modalities to help with their discomfort, like, warm salt water rinses, ibuprofen, cold compress, different things like that to kind of help with their discomfort and managing your patients better. So the old adage was just, take out the teeth, give them the Lortab. I mean, that's just what the norm was. So I guess recreating the norm is something that's going to help.
Yeah, definitely. And I guess since they've been kind of made to switch over, have you noticed a change yourself, and I guess from your previous experience, and then I guess maybe the education that you all have been doing, I guess your clients or patients are, when they come back for treatment, they're not asking for like the same thing that they may have asked for in the past, or they're kind of getting with the program
They
of what's
ask.
going on. Oh,
No,
they still ask.
they ask,
Yes.
and they ask, and we educate, and
Okay.
they ask.
Yeah.
There's patients I've never even seen before that will call. So it's just, you have to just recognize, what's going on. They ask, and they probably will ask until Kingdom come. Or if I take out a tooth and then I hand them that 800 milligram ibuprofen prescription, that's all I'm gonna get. Yes, ma'am. Yes, sir. That's all you need. Just educate. And most of the time, once you educate people, they're like, oh, okay. So it just takes the time to just educate your patient and staying strong on, well, my other doctor, well, that's not where we're at. So just educating and being strong, with your patients.
Yeah, no, definitely. No, I agree. It's going to take some time, but I can definitely see a change, especially in Tennessee, well, because we have the highest rate of the opioid use, so hopefully it gets under control. And that's that question, I guess, just in dentistry, just random questions. I guess with kids and then with the elderly, I guess with kids first, when should you even start to bring your kid to the dentist? Like what age?
When they get their first tooth.
Oh, first tooth come out. Crack that first tooth.
When they crack their first tooth, that's
Okay.
recommended, but at least by age 1.
Age 1. Okay.
And the reason for that is not, when we bring them in, when their first tooth cracked, they're normally 6 months or more. It's not to do any extensive dental work on them. It's to get them used to coming to the dentist. We want them to come in when there's nothing that's bad that's going to happen. Because what we don't want to do is traumatize the child.
Got you.
We don't want them to come in when it's too late and Johnny's got, several teeth that need some attention. And then their first experience with the dentist is something that's negative. You don't want that. So it's good to first come in when their tooth first comes in. And that's more so like an education appointment, getting Johnny used to being in the chair, hearing the sounds, the different things that are going on, and to educate the parent. Because a lot of parents don't know, not to let their children go to sleep with a bottle in their mouth of milk or a bottle of juice. Just kind of educating the parents, or letting them know, if Susie drops her passy, don't put your passy in your mouth to lick it because you're transferring your bacteria to your child's mouth. Let them know about nutritious foods, how to properly take care of their teeth. It's more so educating the parent and getting the child used to coming to the dentist without any fear.
Yeah, no, I got you. No, it makes total sense. So I guess now with the elderly, the dentistry back then is not the dentistry of today. A lot of the elderly only went to the dentist. I would say the elderly, maybe 60 and up range, I would say, would only go to the dentist if something was wrong. So I guess what is their experience now at the dentist compared to, because are they like, is it like what type of things do you see with the elderly? What kind of problems do you see with their?
I mean, you get a range of people. I know for my mother herself, she's not in her 60s. Mom, you're not in your 60s. You know, she's in her 50s. But when she was growing up, like you only went to the dentist when something was wrong.
Yeah.
So in her adulthood, when she got her own, job and got her insurance, she learned about the preventative sides of things. So I guess as you learn more now people are going for preventative and taking care of things. Now they're being educated and know better. So I guess as the time periods goes on, you get more education. So now, people in their 50s and 60s are coming for regular maintenance, just like, other people are now that have been educated, and there's dental insurance and access to care that more so that they didn't have coming back in the past.
Yeah. And do you see like any like particular common problem more so with the elderly? I'm just
periodontal disease, gum disease.
Okay, that's what I was thinking. Okay.
Yeah.
Kind of explain what that is, I guess.
So, the periodontium is like your gums and the bone in your mouth that holds your teeth in your mouth. Okay. So as you get older and, different bacteria and things that are in your mouth, the bacteria eats away, you get bone loss. Okay. So once you get bone loss, remember the only purpose of bone in our mouth is to hold our teeth in your mouth. So if you lose bone, teeth start to get wiggly, gums get inflamed and puffy and bleeding. So a lot of the adult population has periodontal disease. So loose teeth, bleeding gums, different things like that. And remember, we talked about those same bacteria causing, being correlated with heart disease and stuff like that. So
you say a lot of the population, that means it's pretty much common when you see somebody, they probably got periodontal disease.
Mm-hmm. Especially if they've never, and especially if they don't go to the dentist on a regular basis, they're probably walking around with undiagnosed periodontal disease.
Okay, definitely.
Or at least gingivitis.
Yeah, that's interesting. All right, so let's get to talking a little bit more about your practice. So I know in your practice, you do general dentistry, cosmetic dentistry, sedation dentistry, restorative dentistry, Botox, everything you can think of. So kind of, I know what general dentistry is. Well, I don't know what general dentistry is. I go to the dentist generally. But on my regular scheduled visits and stuff like that, the preventative care, all that good stuff.
Yeah.
So I'm kind of familiar with that aspect. Can you kind of just give me a brief overview of what the general dentistry is, the aspect of that?
General dentistry is just, your cleanings, your fillings, dentures, partials, just, regular general dentistry.
Yeah, for sure.
Yeah.
All right, so let's just move right on to talk to me about I guess cosmetic dentistry. So that's interesting as well. So tell me a little bit about that. What does that include, cosmetic dentistry?
Cosmetic is something that you're doing by choice. Like, It's not necessarily something that you need. It's just something that you want. Like, people don't need teeth whitening. You do teeth whitening so you can have a pretty white smile. It's not something that, if you don't do it, then your teeth are going to rot out or something like that. So teeth whitening, veneers, crowns, stuff like that.
Okay. I guess, I got a question definitely in regards to the veneers, but in like the other stuff, I guess, what's something that's trending that you kind of do, one of your most popular cosmetic procedures?
Veneers and teeth whitening.
Veneers and teeth whitening. Mm-hmm. Why would you say, I guess it's trending.
Everybody's want that. They want that popping white smile. They want the baby smile. They want that loving hip hop Atlanta smile. Everybody wants those pearly whites.
Okay, and I would say, what age group would you say the teeth whitening or the teeth whitening or veneers would you see most prevalent amongst?
I would probably say late 20s to 40s, probably.
Okay, mm-hmm. Yeah, that's interesting. I guess this particular age with the social media or the digital age, I would say that would be the biggest part. So. Just speaking about it, veneers in general, I know they don't come in sizes. So I've seen all shapes and sizes of veneers. And veneers, from what I've researched, they date back years and years, hundreds of years, or at least 100 years for sure. So I guess the popularity of the digital age and pictures and all that good stuff has made it more trendy to have the perfect smile. So kind of expound on that. What would actually, because I know 20s to 40s, normally that's not the age men I would think in my mind envision a person trying to get veneers or something like that. So can you kind of expound what would be the normal recommended age? 'Cause I know the veneers that don't last but for a certain amount of time. Is that correct?
Well, it's not a particular recommended age. It's just like I said, it's cosmetic. So it's
Yeah,
something you don't need it, but you want it. So
Yeah.
you get it when you want it. If you got the coins, then you get it.
Yeah, for sure.
So people get them for different reasons. So a lot of it is time. So a lot of people have, spaces in their teeth or a little bit, malaligned teeth, and that they don't want to go through orthodontics, so they get veneers. Or if they've got some chipped teeth, they don't want to, cut down their whole tooth, they get veneers. Or if they've got some stain and discolorations in their teeth that can't be fixed with teeth whitening, so they get veneers. Or they just want to be extra and do what everybody else do, and then they get veneers.
Yeah.
So it depends. Different people have different reasons for getting veneers.
For sure. Now, they don't come in sizes, correct?
Well, no. Yes and no.
Okay.
So you can't just, here's a veneer size, but I want those. That's not really how it works. Like
Okay.
if your natural teeth are more so square type teeth in shape, then more so your veneers are going to be square. You can change them a little bit, but it's not going to be drastic. Otherwise, you would look like horse teeth. It just depends. It just depends.
Yeah, I've seen some that I'm not to on TV like from different celebrities. They kind of look a little bit extreme. You know what I'm saying?
Yes.
So, but it's just funny to see. So, but they're meant to kind of fit your teeth. How long do they last in general? Or do you all still do preventative care while they have veneers on the
You
actual
have
natural
to.
teeth?
So
Go ahead.
veneer is just that, if you put a veneer of paint on something, it goes over something.
Yeah.
That's exactly what veneer in dentistry means. So veneer can be porcelain, or veneer can be composite resin material. It goes over your teeth,
Okay.
and it's bonded to your teeth. So once it's bonded to your teeth, it's bonded to your teeth unless it comes off. Sometimes you can do them without shaving down the teeth, and sometimes you cannot. But once it's over your teeth, it's not something like, oh, it's on my teeth today and tomorrow it's just going to be off and my teeth are going to be the same way they were before I got them done. It's not the case. A lot of people make it seem that way, but that's not the case.
Okay, so you still have the maintenance on the natural care of the teeth. But,
You still have to, you still have your gum health and things like that. You have all your other teeth that are not veneer. So you still have to come in for your 6-month, maintenance cleanings. You still need to, sometimes veneers are very, very, very thin. So if you have a clenching or a grinding habit, then you can pop your veneers off frequently. So a lot of times a dentist will recommend a mouth guard for you to wear after your veneers are made if you have that particular type of habit.
Okay, yeah, that's interesting.
Mm-hmm.
All right, so I guess talk to me a little bit about sedation dentistry. I guess they're just putting you to sleep and then going to work, right?
There's different types of sedation.
Okay.
There's oral sedation, there's general sedation, there's conscious sedation. There's different types of sedations. So there's one type, general sedation, like being put to sleep means you get IV in your arm, you get the tube in your down your throat, you're out.
Oh, wow.
Okay, that's generally, hospital-based type of sedation where they do that for kids. So say you have a young kid that's, 3, 4, they have a lot of work that needs to be done in their mouth. Most times kids are not cooperative. So they go under general sedation in a hospital-based type of arena.
Okay.
So that's where you sleep. You don't have control of your reflexes, you're out. Then you have IV sedation, which is kind of like comprehensive or conscious sedation, where they put a IV in your arm and give you some medicine through your IV, and you're kind of you're aware, but you're not aware. You can still control your own reflexes and things like that. That's IV sedation. You have oral sedation, where you take a pill and it just kind of helps you with your anxiety, kind of gives you, a woosah, calming type of effect. You'll take that, hour before your appointment. You have to have a driver, and they drive you to the appointment, and you just chill. And then there's sedation with the gas, which is nitrous, where you breathe in some gas and just kind of helps you calm and relax. So there's different spectrums of sedation.
Okay, yeah.
Mm-hmm.
Well, no, that's interesting. So with you see all the funny videos that you may see on social media and stuff like that. What kind of sedation are those people using?
Most of the time it's IV sedation.
Okay, IV sedation.
Or nitrous.
Okay.
And how people react differently. So that's why you see some people react really, really funny. Some people are chill. Everybody reacts different.
Okay, okay, that's interesting. All right, so with that, what type of patients do you kind of utilize or do the sedation for? What's a trending?
anxious patients.
Anxious patients.
I have a lot of people who are highly fearful of the dentist. They don't like the sounds. They don't like the feeling of it, of anything. They don't want to be really aware of what's going on. They hate getting shots. So for those type of people who are, highly anxious and, fearful, they're the best candidates for sedation.
Yeah.
Or longer type of procedures. If you want to do a lot at one time, then sedation is a good option as well.
Yeah, no, that's interesting. Is there like a certain particular group that you may see more, maybe more males do sedation or more females do sedation, or just random?
It's
could
equal.
Be anybody.
Most people are afraid of the dentist. I mean, it's everybody. Yeah. Everybody, do you do nitrous? You got nitrous? Everybody, people don't like the dentist. It's just
No, that's
I can understand it because I don't like getting my teeth scraped on, either. So I definitely understand it.
No, for sure. All right, so I guess restorative dentistry, is that kind of what the cosmetic
restorative just means just restoring something. Like you can restore missing teeth, you can restore like of a decay. You're gonna restore the tooth after you take the decay out. It's just a term.
Just kind of building it back up.
Mm-hmm.
I mean, I know you do Botox as well, right? So that's something I don't commonly associate with dentistry.
You should, because dentists are the head and neck specialists. We learn all the muscles and arteries and veins and such in the face. We're the prime candidates to do it.
So tell me about it. Tell me why, because I don't know nothing about that. This is like for yourself being hearing that you do Botox at the dentist office. That's just interesting to me because I've never heard of that before. So maybe I just go to an old-fashioned dentist. I'm not sure if that's a common thing.
It's a personal preference. Like I was telling you, I like everything beauty, confidence, health, and wellness. So if I can do something, A, I like it, and B, if I can do something to help somebody else, then why not? And also, so Botox, if you want to delve into it, into a little
please
bit.
do. Tell me first, can I kind of explain what it is?
Okay,
yeah, basically.
So Botox is a brand name, actually.
Okay.
So there's Botox, there's Xeomin, there's Dysport, there's Juvo. What it is it's a protein made from botulinum toxin, okay? So
I'm not even okay. You can explain it if you like. But
so botulinum toxin, what it does, the protein that's used in all those materials, what it does is that it paralyzes muscles.
Okay.
So if I raise my eyebrows, right, there's a muscle that's allowing me to raise my eyebrows. When I raise my eyebrows, those lines form because the muscle is moving and the skin is above it, right?
Yeah.
So if you do Botox to that or Xeomin, whatever botulinum toxin you want to do, if you inject that toxin into that particular muscle, it blocks a receptor so that muscle cannot move. Okay, right? If that muscle can't move, I can't form those wrinkles that are right there. So then it's smooth.
Yeah.
So that's how Botox works.
Kind of keeps you young, I guess.
Keeps you young and smooth, and you don't have those wrinkles. Or if you smile, when I smile, some people, not me, because I Botox, but some people when they smile, they get these little lines that come around there. Why? Because there's a muscle that goes all the way around our eye, orbicularis oculi. I know that because I'm a dentist and we learn all the muscles in the face. But that movement of that muscle makes the lines bunch up there. So if we put little Botox around there, it keeps those little crinkly lines from starting up, and then you look young. But there's also dental implications for that. So people who suffer from TMJ pain or they clench or grind their teeth, if you put your hands here and you clench your teeth, come on, go ahead and do it for the viewers. Put your hand here and clench. You feel that muscle popped out when you clench? That's called the masseter muscle. So that muscle controls how much you can clench or how much you can grind your teeth. So if we put some Botox in that muscle, it makes that muscle not be able to contract as much. You're not clenching and grinding as much. You're not waking up with headaches and migraines and things like that. So that's one dental implication of it. Or some people, they smile. Like me, I show a lot of gum when I smile, So if you put a little drop of Botox in their muscle that's there, you don't smile so big. You don't have so much of a gummy smile. So that's a dental implication. So if you're doing, crowns or veneers and you don't want somebody to see all that the line there, you can do some Botox. If you want to show more lip, you can put a little. I mean, it's just so many different implications of how you can use Botox for not only facial aesthetics but for therapeutic as well for TMJ pain and teeth grinding and clenching.
Yeah, no, that's interesting. I just thought Botox was a particular surgery. I didn't know it was actual protein or anything like that. I just say, okay.
And it's not actually a toxin that you're
But
putting in there, it's the protein.
it's the yeah. Okay, no, that's interesting. And you said even yourself, you utilize Botox.
I do. You know, a lot of black people think that they're black don't crack. Well, I'm gonna make sure, you know, not too much, but you know, just a little bit.
Put the plastic cover on
little bit here and there, you know.
Nah, I feel you. So, is there? I guess since you said paralyzed, that kind of makes me nervous from what you say. Well, not. I mean, not the procedure's probably fine, but I'm just saying in general, just the phrasing of that term. So, what kind of like effects would it have, like long term? Since are you not able to use that muscle anymore ever, or does that go away?
It goes away. So, it blocks the receptor, the acetylcholine receptor. If you want to get fancy and scientific, but new receptors form, and so in 3 to 4 months that it wears away and you get the movement back. It may be a little bit decreased movement, but you still get some movement back. So people who get Botox, they have to get it done every 3 to 4 months. So it's like it's a maintenance type thing.
Oh, okay. No, it makes sense. Definitely makes sense.
But there are side effects of it though. If you get some material in the wrong place, so say, you know, you're putting Botox in this area here, where this muscle goes all the way around here, and there's a muscle that goes this way. So sometimes if the material gets to where it doesn't need to be, you can have like the drooping of the eye, or you can be too surprised. So you've seen people who like, they look like that. So there's different things that can happen, but it will go away in about 3 to 4 months. And also we're sticking needles in your face. You can bruise, you can, you know, bleed, swell, different things like that, because you're getting a needle in the face, in the skin. So there's different things that can happen because of it.
Yeah, no, it sounds like a very serious procedure for sure. Definitely. So I kind of throws me. I'm just kind of in awe. Just kind
you want some Botox now, don't you?
I'm not. I ain't good. It's just interesting to kind of hear, because I really never knew or explored it. And I know you kind of talked about, I guess, the trend of more people just kind of cosmetically doing. Just getting the stuff fixed instead of the preventive care. But I also wanted to talk to you about, since you were in the military, kind of talk through your dental services. I know that you also serve your community by kind of having like an annual Freedom Day USA, by providing free dental US to all like the military veterans and stuff like that. Can you kind of tell me a little bit about that?
Well, because of my military background, I wanted to do a service to somebody that to my community. But a lot of people, when they get out of the military, they think, that your medical is covered forever, your dental is covered forever. But you don't get dental covered unless you have a service-related injury that happened to your mouth. So there's lots of veterans who don't have dental coverage. So it's just my way of giving back, to my particular tribe, of veterans, where once a year they come in, I do free exams, cleanings, extractions, fillings, whatever it is that, they need that particular day. I do those services for free for veterans, just to give back to my community for their service and what they did for us. So it's just my way of giving back.
For sure. I like it. So I know also that you are, mentor in the Student Empowerment Partnership Program. Mm-hmm. Can you kind of talk to me about that, explain what it is and what you kind of do in that particular program?
University with me, she is a PhD student, and she came up with this program that's called the STEP program. And so I happened to see her a couple of months ago when I was back in town at a Black Business Expo, and we met up, and she was telling me about the program that she's got going on. And so what they do is that there's different people from different fields, whether it's dentistry, doctors, lawyers, different nail artists, whatever that particular type of business is. They mentor these high school kids. It started at Hillsborough High School. So the students get to say, hey, I'm interested in dentistry, or I'm interested in being a nail artist, or whatever their interest is. They go to that particular mentor, and they, meet with them once a month and different things like that, so they can do that. I also, like, if there's students who are interested in being dentists or wanting shadowing opportunities, I let them shadow in my office as well.
Yeah. So how do they get it? I guess familiar with the STEP program, or is that something that, since I'm not sure, is it in schools or something that I don't know about?
It started. It's at Hillsborough where they started, and they're trying to branch it out to other schools. But COVID happened, and so different programs are not allowed to be into the schools, because they went virtual in Davidson County. So it's she's trying to figure out her way to work around the COVID type of things. But they have an Instagram page. It's STEP program, STEP program.
Okay,
It's
cool.
on Instagram.
Yeah, definitely. I think that's a cool program because it's always good. Just that's kind of like why I have you here, just to kind of share on how you got to where you're at, just for somebody else to maybe be inspired or kind of find their own path as well. So, what about yourself in Definition Dental Studio? But did I say the name? I mispronounced it.
Definition Dental and
And Wellness Studio.
Spa.
Okay. Tell me
we
about
got
the spa part.
we got a new room. It's
'Cause
called the Serenity Room.
So tell me about it, because I kind of missed out on that.
So I changed the name coming from some advice from a friend who is a business guy. He was like, when I think of the dentist, I don't think about all these services that you offer. He was like, so you should change the name so that it kind of tells, so people know that they can get these spa-like services. So that's why I kind of changed the name a little bit. So Definition Dental and Wellness Spa. So we do
hot towel treatment or
hot
something
towel treatment. So, once we get done doing your extraction or your cleaning or your fillings or whatever, we bring our patients a hot towel. Because, you get all that gunk and all that crap on your face. And it's just that extra touch to make people feel just comfortable and just a little woosah moment. So we bring them a hot towel when treatment is over. Or if they're coming to treatment, they want to come a little bit early, we have a Serenity Room so they can come and sit in the little massage chair. They can get some hot tea, hot coffee, water. I mean, they can just relax and kind of zen out a little bit before their treatment.
Yeah,
we have body contouring, non-invasive body contouring.
What's body contouring?
Trim fat, tone muscles and tighten skin.
I'm familiar with this territory. So what you mean trim fat?
So if you got belly fat, if you got, loose skin under your arm, or maybe you're a new mom and you've got some, loose skin on your belly, you want to kind of tighten it up a little bit, or if you're a person who works out, you're eating healthy, but you still have that pesky little area that bothers you that you just can't get away, we can do body contouring services for that using radio frequency treatment and electrical muscle stimulation.
Okay, sounds interesting. So you just kind of shock it out or shock it into place?
Pretty much.
Okay.
And it contours the body. There's definitely research on radio frequency and heat killing fat cells and remodeling, things like that, and collagen building. So, yeah.
Pretty sure you just can't put a heating pad right there and kill. It has to be a specific type of temperature.
It's a specific temperature that it has to get to, safely get to that temperature, yes.
A little bit
it's
more
targeted.
scientific than that, I'm
sure. Yes.
For sure. All right, now I appreciate you coming in. So tell me, do you have any kind of upcoming ventures or news that you kind of like to share or put out there, or tell them where to follow you at, or
yes.
or where is your studio located?
So we are located in Nolensville, Tennessee, on Nolensville Road. So we're close to people who are in Antioch, Smyrna, Brentwood, Franklin, Murfreesboro. We're close to, kind of like a central location. You can follow me on Instagram or Facebook at Definition Dental Studio. As far as new things coming up, we just introduced IV nutrition into our practice. So we do vitamin B12 shots. So if you're low on energy, you can do vitamin B12 shots. We're going to start doing IV nutrition with, if you've got a hangover. So instead of going to the emergency room to pay $500 for some fluid, you can come into Definition Dental and get you some fluid. We do Botox parties. We do concierge. I come to you. So just find us on Instagram, DM us, follow us, share. You may not need it, but somebody else might. So just share it and yeah.
Yeah, for sure. No, it's good stuff. It's all interesting. It sounds like a lot of fun, but I don't even like all this stuff, getting a hangover and going to the dentist, getting the juice.
Don't think of it as going to the dentist.
The wellness spa.
I am more than just a dentist. I am Dr. Mrs. Pretty. I am Tiffany. I am mommy. I am sister. I'm not just dentist, but I am a dentist.
Yes,
but my business incorporates other things. I have other advanced training in other procedures. So I'm not just a dentist randomly doing things. I have training. I train with the American Academy of Facial Aesthetics to hone my skills on Botox, on fillers for lip enhancements and different things like that. So I'm a dentist, but I have extra training.
Yeah, no, for sure. I'm glad you corrected me, because I just use the term as just like a normal person.
I'm not just a dentist.
Yeah, I'm not.
A dentist is not who I am. It's my profession. It's my trained profession, but I do other things as well.
Yeah, I'm just
which
here to get the knowledge.
Which I'm trained to do as well.
Exactly. A very knowledgeable professional.
Yes.
Within yourself. So now I appreciate it. Now,
wellness advocate.
Wellness advocate. Hey, I'm a wellness advocate for myself.
Yes.
I definitely am. But no, I really like to thank you for joining me here today.
Thanks
and
for
I
having
really
me.
appreciate it.
I had fun.
Yeah, no, for sure.
Yeah.
Thank you. Hopefully we come back again soon, share some more stuff. And thank you again.